So I've been getting a lot of questions lately about escape maintain behavior. So I figured I'd pop on here and talk to you guys a little bit about it. I've been doing a lot of different teacher trainings and parent trainings, and it's interesting to me that some people don't fully understand what escape maintain behavior is. Sometimes we think it's automatically that the kiddo is running away or that they're avoiding the task or the demand, which very much so is the case. However, escape maintain behavior can come in lots of forms, right? Screaming, for instance. If I'm screaming, I'm not doing the demand that you gave me. Tantruming, dropping to the floor. Anything that gets that kiddo out of doing what the demand was, right? So if you said, do puzzle, and he starts screaming in the top of his lungs, in place of doing this puzzle, he's still escaping that task. So there are three important things to remember with escape maintain behavior. And that is the interventions we want to put into place or what we should be doing as a practitioner. This will help you in your practice and also help you for the BCBA exam when you get those tricky scenario questions. So there's three things that you can do. You can offer contingent breaks. Okay, and what does that mean? That means when the client asks for a break appropriately, whether it's with a break card, a PEX card, sign language, verbally, then you can give them a contingent break. Some of the ways in which we do that, we might use a timer so that the break doesn't go on for too long, maybe 2-minute breaks. Maybe they can work up to 5-minute breaks. Actually, we want to minimize the time, right? Not too long. But what we want to do is offer those contingent breaks, because if we teach the client how to actually ask for a break when they actually need it, then they no longer have to engage in that escape maintain behavior because they know their break is coming, right? Another thing that we can do, the second thing that we can do, is give our clients a choice of what they may want to do, right? So sometimes we have a schedule set for them, or sometimes we're just verbally explaining what we're going to do. We're going to do a puzzle. And then after the puzzle is complete, you say, okay, time for PEX. PEGs. And then when that's complete, you say, all right, time for sensory bin. However, we might not realize that those aren't all things that our client wants to do. And remember, in ABA, our programs are interspersed with preferred and non-preferred activities. So what we really want to do is give the client the control. If they keep escaping every time we place a demand on them, say, okay, well, what would you like to do? And a really great way of doing that I do with a lot of my kiddos is just have a picture schedule with the Velcro on the back and just have them, navigate what their schedule is going to look like. We're going to get much more of a response when they have that control, when they are in charge a little bit. And the escape maintain behaviors are going to be minimized because they had chosen these activities. So that gives them an MO to then engage in those activities. And the third thing you want to keep in mind is that we may have to reassess. If the client is always leaning towards escaping, we have to make sure that our assessment and our treatment plan lines up with their abilities, because we don't want to make the programs too challenging, and that's why they're escaping. We want to make sure that we have done the assessment the proper way and that it lines up with the treatment. So we can always do a reassessment if we see that there's a big increase in those escape maintain behaviors. All right, guys, thanks for joining. I'll see you next time.